Judge, welcome back to the program. Happy New Year to you. Last time we talked to you, you talked about two things that you're really hoping Travis County can make a dent in. That is mental health, and secondly, in childcare. Let's take these two separately, two separate items here, because you guys have been working towards both of those goals. Mental health diversion, where does that stand now?
Mental health diversion is moving along. We've got some funding set aside here at the county level. We have great partners with Integral Care, that's the mental health provider in Travis County. And so the idea is, if we could put this thing on the property of the Austin State Hospital campus, which is centrally located here in Austin, we are hoping to partner with the medical school, the UT Medical School here, as well as our mental health provider, Indigent Healthcare folks, to build something that when people get arrested, the police here in Austin and Travis County and the sheriff's department will have one place to take people. They don't need to know if they're getting diverted to treatment or if they're being arrested necessarily. They just know that there's one door where they can take them. Yeah. And then on that back end, we figure out, is it somebody that needs to be arrested and booked? Is it somebody that needs to be booked, but then given a chance to go through the mental health diversion center? Or is it someone that just needs to get that mental health help directly? Once they're in that mental health diversion center, the models that I've seen around the country have sort of a mandatory portion to it where they have to stay there for 14 days, like in Nashville, to receive treatment, get stabilized. And then in Nashville, nobody is let out back onto the streets to an unstable situation. They either have to go into some kind of housing or supportive housing or go with a family member. We've also got a bill that's, I think we hope to have this session that will help us get it established like we want to on the state hospital campus. And so, nothing's going to happen before session is over. But my hope is, with this, bringing this company on to help design and build it, if we're able to work with folks at the state level to get it established at the state hospital, that we could hopefully start construction sometime soon after the legislative session.
The other big priority you and I have discussed in the past is childcare, and people are just being priced out of it. Moms and dads can't afford it, and they can't afford it. They can't take part in the workforce. Where does this stand now?
Yeah, so we are the first county in Texas, the first entity in Texas to pass affordable childcare on the ballot. And I think Sonoma County may have done this in another state, but we're one of the very first nationally to do this as well. And the idea is that this will help eliminate the wait list of parents who are trying to go back into the workforce, maybe to get job training and improve their lot in life. But they can't because they have a newborn and they can't find childcare that they can afford that is high quality. And so that's a several thousand person wait list. It is about a 24-month wait list for people here in Travis County currently. But Travis County voters invested in this by supporting it in November, and it passed with 60% of the vote. The program will start in January. So the funding will start in January. And so what we're putting together is a way to increase childcare slots available to people here in Travis County in that first year. And in the second year of it, our hope is to help new providers pop up, especially in places in Travis County where there are childcare deserts, to make sure that our economy can continue to flourish, that people who want to enter that workforce can do so and know that their kids have great high quality childcare. And it's not only going to help our economy short term by helping employers here and helping individuals, but it's also long term. It reduces the medical costs for people 20 years down the road. It increases high school graduation rates, 18 years down the road. There's a lot of benefits to our economy today and also in the future.
Judge, always good to talk to you. Happy New Year to you.
Thank you. Happy New Year.